Well, thank you so much, Paula. And I really am thrilled to be here. I actually have to say that in the few minutes that I've been here, I've run into so many people from that I know in southwestern Ontario, particularly London, and it really does feel like I'm home. So great to see you all, and I want to say thank you so much for spending the day here, for learning from one another. I've asked people, so how's it going? And without exception, people have told me that they have learned, that they have created connections that didn't exist before. So I want to say congratulations to Jeff and Mike and everyone, Kelly at the Southwest LHIN, who have pulled all you marvelous, marvelous people together. So thank you so much to the LHIN. I want you to know I haven't been here all day, but I have been following Twitter. I've actually I've been touring Southwest. I've been in Goderich and Wingham and now Stratford and heading back to London. But so I've had time in the car, not while I've been driving, to check Twitter and get an update. And where's the Twitterer? I don't know. Oh, they're back there. There he is. I actually, before I got here, I don't know how many of you are on Twitter, but I actually looked to see the chronology of today's tweets and all the marvelous, marvelous speakers that you've had, and I think this is an exceptional gathering of exceptional people. I've heard also how impressed people have been by Jim Easton's talk this morning, and one of the tweets read a quote from Jim Easton. He said, "To you, in your hands is the future of the most important public institution in your country." That is a very powerful quote. I'm going to read it again. "In your hands is the future of the most important public institution in your country." I have to tell you, I completely agree with that. I've been Minister of Health for a year and a half now. Unbelievable experience, meeting wonderful people who are passionate, brilliant, and committed to patient care. And as I've spent more time in healthcare, my mission as a minister has become simpler. You see, I think that the most precious gift that has been given to our generation is the gift of universal health care. It was given to us by a generation ahead of us. It was hard fought. There was enormous opposition to the concept of universal health care, but people before us fought for this. You know, when there was a contest, who was the greatest Canadian, remember who won? Tommy Douglas. Because Canadians believe that this is an institution worth fighting for. It's an institution worth protecting, and it's an institution worth fighting for. So my job as Minister of Health is actually to drive the kinds of changes that must take place so that we can pass on to the next generation and the one after that the gift that previous generations gave us, and that is the gift of universal health care. Care on the basis of what you need, not how much you can afford to pay. It brings enormous peace of mind to all of us to know that the people we love will get the care they need no matter what. It's, I think, you know, when we read stories about what happens in other parts of the world, we really are reminded how precious universal health care is. There's been lots of talk about the sustainability of our system, and it's one, as a demographer, that I have to tell you I am consumed by. We know our population is changing. There is a demographic shift underway. Our population is aging. Our population is growing, it is becoming more diverse. Medical technology is spectacular. It means more people are living longer with more complex conditions. So how do we embrace that change? How do we see ahead to the changes that are coming and make the tough decisions now about how we're going to prepare for the demographic shift? Improving quality of care is essential to the sustainability of our healthcare system. I'm told that about 30% of what we spend on healthcare is actually wasted on procedures that don't improve outcomes for patients. About 30% is wasted because we haven't driven the quality the way we now need to do. So the Excellent Care for All Act that was introduced and passed unanimously by the legislature forces us to turn our attention to quality. That is absolutely part of what we need to do to protect our healthcare system. So I have to tell, I was just talking to Jeff Lowe actually about, there was a little welcoming committee here earlier of people who are concerned about infection rates in hospitals. And actually they had left by the time I got here, so I didn't have the chance to chat with them, which I for sure would have done. Because I agree, it's a problem, and it's a problem we're addressing. You know, as I was coming here, I was looking at some statistics. MRSA rates in Ontario hospitals when we started measuring was 3.9 per 1,000 patient days. Within 2.5 years, it's down to 2.9 per 1,000 patient days. That's a dramatic improvement because now we measure it. Now we publicly report it. Now we're serious about making the kind of changes to improve those rates. I think that's a good thing. I think it's absolutely the right thing. So we have to make change in quality. We have to do something truly revolutionary. But we have to look at our healthcare system through the eyes of the people we are all here to serve. We have to look at the patient's journey through the healthcare system. We have to understand that most people who need healthcare actually need it from a number of different parts of our healthcare system. It's a rare person who actually goes into hospital and comes out and that's all, especially as our population ages. And you look like people like my parents who are both now well into their 80s. The care they need is not coming from just one part of our healthcare system. They are doing the journey through the healthcare system. So it's time for us to actually take the patient's perspective seriously and start to smooth the journey of patients through the healthcare system, which will be far better for people and also far better for the system. Because if we can provide the right supports at home so that people can get the care they need to stay at home when they come home from hospital, and they're not needing to go into long-term care, and they're not being readmitted into the hospital, it's far better care for patients. It's also far better for our system and the sustainability of our system. So I want to really applaud all of you. You are all here for one reason, and that is to improve healthcare for your patients, for the people you serve. But I want to remind you that the work you are doing today is not just for the people we're serving today. It's for the people we'll be serving tomorrow, and it's for us as we grow into that age and into that stage. So what we are working to do together is to protect universal health care. That is what is at stake. If we do not make changes now, the pressure to move to a two-tier healthcare system will be a very strong and powerful system, a very strong and powerful pressure. I refuse to go there. Under my watch, with the support of all of you and people like you right across this province, we are embracing change. And I'm so encouraged and excited by how passionate people are about embracing change. So I want to say thank you for that. Thank you for thinking about how to do things differently. Thank you for accepting the fact that we are going to be measuring quality and we are going to be driving improvements to quality. It's pretty powerful stuff we're doing, and I am so grateful to each and every one of you for being part of that journey. Thank you so much.